Tonight from our ABC 7 I team, a huge spike in emergency room visits due to the opioid crisis. Now, despite Illinois' offensive against opioids, these latest figures show overdoses escalating. Eyewitness News investigative reporter Chuck Gowdy joining us with those numbers. Chuck?
Alan, opioids tonight still waging a heartland attack. Illinois seeing a huge spike in emergency room visits due to opioid overdoses, according to the latest figures from the Centers for Disease Control and Prevention. According to data obtained by the I-Team, Indiana is seeing a similar increase, and Wisconsin is worst in the Midwest. Opioid overdose cases reported by Wisconsin emergency rooms more than doubled between July 2016 and last September, according to the CDC. Illinois ER visits jumped 66% during the same period.
Whether that be pill prescriptions that are oftentimes intentionally, misused, abused, or overdosed, as well as heroin and even heroin alternatives. So a lot of increase in synthetic opioids.
Nationwide, in that stretch of time, more than 142,000 people were rushed to hospital emergency rooms for opioid overdoses, and CDC data suggests the trend is from bad to worse. I-Team reporting the past 2 years has found a surge in street sales of illicit pain meds and evidence of widespread heroin abuse. Illinois officials have recently rolled out a statewide effort to fight opioid abuse. In December, the Opioid Overdose Prevention and Intervention Task Force established an all-hours helpline for those with painkiller addictions. According to the most recent data, nearly 1,950 people died from opioid overdoses in Illinois, many times after abusers took a deadly potion of heroin and fentanyl, the super painkiller.
Sometimes the patients know that they're taking fentanyl, sometimes they don't. They buy heroin expecting that the same dose will result in the same degree of effect for them and end up significantly, profoundly overdosed, difficulty breathing, sometimes not able to breathe at all.
Federal drug enforcement officers are continually chasing new fentanyl products as they hit the streets of Chicago, mostly produced by illicit labs in China, then shipped by mail to the U.S. CDC says there should be better detection and response to spikes in overdoses and coordinated community responses. Illinois' task force approach really got going after the latest data, so if there are improvements, they may be in the next reporting cycle, although these numbers are certainly not optimistic.